I'm Dr. Thompson Akwo, the Chief Editor of Health and Development Magazine, and we are at the Convention Center downtown New Orleans. This Thursday, the 5th of April 2019, as part of the American Association of Occupational Therapy Annual Conference. With me is...
Hi, I'm Lindsay Fate. I am from Salt Lake City, Utah. I'm a pediatric occupational therapist, and I also teach in the OTA program.
Beautiful. How does this conference impact your work?
Oh gosh, I love this conference. It helps me provide evidence-based practice, keep up with the latest practice trends, and it's also just a great way to feel excited about the profession. So I attend every year.
Good, you've attended every year, so I'm sure you go away with what is new every year. So what are you expecting to be new this year?
I'm not sure yet. We'll see. The conference has just started.
Started. Pretty good. You lecture, right?
Yes, I do.
What are some of the topics that you teach?
I teach pediatric courses. I'm also the academic fieldwork coordinator, so I teach a lot of the fieldwork courses and modalities courses.
Occupational therapy. What does it really mean to the layman?
Occupational therapy to the layman. Occupational therapists focus on what's important to a client and really focuses on a client's everyday occupations, which really means activities that are most meaningful to the client, and we help those clients engage in those meaningful occupations in whichever capacity is necessary based on impairment or disability.
Is occupational therapy the same as occupational health?
Occupational, I don't understand your question.
All right, there are lots of people who work in industries, who do manual work. They are exposed to injurious chemicals and bioagents at their job sites that lead them to certain health conditions, be it petrochemical fumes, lead in lead use industries, and they come up with related health problems.
Yeah.
Would their issues be addressed under occupational health?
Yes, I would say that occupational therapy can address occupational health, and we can play a really important role in the workplace related to a lot of different issues, injuries. So yes, I think there is a role for OT in that.
How many of your attendees do you think are in the health field, like physicians, nurses, occupation rehabilitation people, physiatrists, and what have you?
How many of them attend here?
Yes.
I don't know the number, but I think there are quite a few professions who come to the expo hall to talk about their profession and how OT can apply to that. I'm not sure of the numbers, but there are other healthcare professionals.
There are lots of people who have inborn errors of disabilities, and they come up with lots of disabilities which can affect their ability to perform at work, their ability to be productive in their occupations. What would you say to them?
What would I say to those individuals?
Yeah.
Well, occupational therapists are very knowledgeable with ADA, the Americans with Disabilities Act, and so I think they play a huge role in helping advocate for individuals with disabilities in the workplace, but also helping these individuals advocate for themselves in the workplace based on the laws and ADA.
The final question. You would have noticed that most of the participants are women. What is it that qualifies women and fits them more for the profession than men?
Oh my goodness, this profession does seem very female heavy, but there are male OT practitioners that
Yes.
are incredibly valuable, and we need more males to be